Today I'm going to graduate from medicine, so by the end of the day I'll be a doctor after 5 years of study. Yeah, it's pretty exciting. Wonderful.
Pressure's on, Mum.
I've been a medical student for the time that the Close the Gap campaign's been going, and I've seen some pretty amazing things just in the last 5 years. We've seen a commitment from all levels of government. We've seen the national apology. We've seen lots of things happen, and it's been a really exciting time to be in the health system and thinking about what the next 20 years is going to be like.
Good weather.
Have you ever had one of these done before?
Employment has always been an issue for us, so it is difficult to recruit to the positions. So we have a big focus on developing those staff that we do have and promoting and encouraging them to do training.
When I started to do my nursing, there were, I didn't know any Aboriginal nurses that were around, I didn't know any Aboriginal doctors.
If Jackie and I leave, that's it. It's not the end of Aboriginal health in Echuca, but it's the end of the Aboriginal health workers, because we're it. That's it. So we need more Aboriginal health workers.
Is there enough being done to encourage more Aboriginal and Torres Strait Islander people in health careers? It's a long process, and we aren't just talking about the next 3 years, we are talking about a generation. So there needs to be continued messages and also pathways for children and young people to be able to take those steps.
Aboriginal people bring the cultural expertise to the roles because we know how to look after our own, we know our communities, we know what's going on in their lives.
Clients feel comfortable, they open up, they're able to express themselves more freely, and therefore the quality of care is actually higher.
In the 13 years that we've been here, we've actually got a better, a healthier community.
Knowing the cultural dynamics of that community is something which it takes years for anyone who's not from that community to gather that information, to be competent in it. And that's where Aboriginal and Torres Strait Islander health professionals really have the edge. It does build a sense of pride within the community, seeing that we're taking responsibility, we're a part of the mechanism to close the gap, and we aren't just waiting for people to come in and look after us, we're looking after ourselves and being a part of the solution.
It's one of the most important parts of this idea of closing the gap is having our people participating in health, because something that a lot of people in the mainstream community don't understand is, well, there are all of these health services available, why aren't Aboriginal people accessing them? Why we have a perfectly good health system for everybody else, why is the health of Indigenous people so poor? And sometimes I just ask, how can you expect us to want to access health services if we can't participate in those health services? If it's completely foreign, there's no friendly face there, and there's no way of relating to that health service.
This will draw the blood into it. To go and do Aboriginal nursing, it was something that I felt I could achieve so that I could, in the long term, look after my people.
I'm currently studying at VATCHO, doing Certificate 3 this year in Women's and Babies Health, and a Certificate 4 next year in Women's and Babies Health, and then complete my health workers training, and then after that I'll do my midwifery training.
I thought that I could never go to uni because I dropped out of school year 11, and yeah, like I went to uni, you know, and it was all because of the help at RMIT. I got scholarships, they just pushed me.
There's lots of reasons that make health a good career for me, and first was my experience growing up and seeing my family members and my extended family having the burden of poor health fall upon them at early ages.
My sister, she was a big inspiration. She's been through a lot her whole life, and I've been there with her. And just the way that she was treated in hospitals, and you know, just really grabbed me and just thought I could do a lot better, you know. And for my people, you know, that's the biggest one.
3.8, thanks sweetheart. Beautiful, young, presentable young Aboriginal people that tried to get work around Echuca and couldn't. And then before I knew it, you know, they were with our drug and alcohol worker. They were, you know, with drugs and alcohol problem. I said, this has got to stop. So we're trying to prevent, and that's why I chose to be an Aboriginal health worker, to prevent from this happening.
To see the satisfaction I get in emotions and how people tell me I've done a good job and how I've helped them out, it really lifts me up and just makes me feel proud.
I had a client sign up on the program, and she was really ill. She couldn't walk properly. You know, she was very unfit. She had a number of health problems. But since joining our Active Elders program, she's given away her walking stick. She's able to walk more. She's able to do things. She's got a job now. Yeah, so I guess it's changed her whole life. And you know, that right there is the thing that, you know, makes me really happy. Makes this all worth it.
I'm going to show you what your ears look like.
What worries me is that this momentum that we've built up and this public awareness that we have at the moment will cease. And what I would hate to see is the issue of Aboriginal and Torres Strait Islander health falling to the back burner, to governments not being interested anymore, to the public, you know, getting a little bit fatigued with what is obviously a really difficult situation. It's not just a fad or an issue that's important now, it's something that matters to communities because it's their people's lives.
What we'd like to see from government is a commitment with Close the Gap within a generation, that it remains front and centre for the next 20 years. It needs to have a very focused approach, and it needs to be relevant to the communities which it is actually designed to improve their health for.
As I walk through them doors, I feel powerful, knowing that I'm closing that gap just a little bit.
One day, hopefully, you know, I'll be good enough to manage the unit, if not the place. You know, I just got to get skilled.
It takes a united Australia to close the gap. We can't do it on our own.
All around Australia, Aboriginal and Torres Strait Islander health workers, nurses, doctors, dentists and allied health professionals are working hard for change. They've dedicated their careers to closing the gap, but they need our support. Tell government we expect them to maintain their focus and keep Aboriginal and Torres Strait Islander health at the top of the political agenda, and that boosting the Aboriginal and Torres Strait Islander health workforce has a key role in closing the gap on health inequality. Log on to www.oxfam.org.au/closethegap to take action. And sign up for regular campaign updates. Tell people at your workplace, your school and your community about the issues and how they can become involved. Let's make sure 2011 brings us 1 year closer to closing the gap.
Whoever's in the health industry now who's Indigenous, we're only just the beginning. Like, there's so much more opportunities out there for Aboriginal people to be in health services.
I feel fantastic. It's unreal. I've worked for the last 5 years and it's all finally come today. I've got my piece of paper, so I'm a doctor now. Beautiful. I can go out and do what I want to do. I've been working so hard for so long, I didn't think it'd ever happen, but it's been one of the best days ever.